Cholera outbreak in the country has outraged many, following 22 confirmed deaths in Hammanskraal and one in the Free State. Just yesterday, the city of Tshwane and the Water and Sanitation Department outlined closer working relationships in sourcing the funds and tackling the problem. Dr. Sean Phillips is the Director General at the department and joins us now to discuss this. Thank you so much for making time for us, Dr. Phillips. So the minister had a meeting with the Tshwane mayor yesterday. They held a briefing together. What measures are being taken by both your department and the Tshwane Metro to ensure people of Hammanskraal have clean drinking water?
Thanks very much, Clement. Good afternoon to you and your viewers. Clement, in terms of our constitution, municipalities are responsible for water and sanitation services, which includes wastewater treatment and water treatment and water distribution. The problem in Hammanskraal is that the wastewater treatment works there, the Rooiwal wastewater treatment works, which falls under the city, doesn't have sufficient capacity to deal with the amount of sewage coming through it, and also it hasn't been properly maintained, and it is not treating the wastewater treatment to adequate standard. So poorly treated wastewater, which is basically sewage, is flowing into the Arpies River, which in turn flows into a dam in that area from which the city's water treatment works, the Tembo water treatment works, draws water. And that water is so contaminated by the sewage from the wastewater treatment works that the water treatment works can't clean it properly before it's distributed to people. So the city has been testing the water from its water treatment works, and we've also been checking those tests. And both the city and we say that that water is not fit for human consumption. So the city has been warning the people in Hammanskraal not to drink the water coming from the taps and only to use it for other purposes, but not to drink it. And they've been supplying water from water tanks to enable people to get drinking water. They've been testing the water in the water tanks to try and find if that might have been the possible source of the original case of cholera. But we, unfortunately, through their tests, and we've also been testing in various places, locations around Hammanskraal, to find the original source of the cholera bacterium which caused the infections. But unfortunately, we haven't found the original source. We're also working very closely with the Department of Health, who, in addition to our testing for cholera in the water, they're also tracking and tracing the patients with cholera to try and trace back to the original person or persons who got infected. Because cholera can be spread both from water and by food and through the preparation of food. So if the original person who got infected then went on to handle food without washing hands properly, it can then spread quite rapidly through other means other than from the water supply. Now, the key issue in the longer term, in the medium to longer term, is to fix the Rooiwal wastewater treatment work so that it no longer pollutes the water supply, which is treated to supply water to Hammanskraal. In that regard, our role as the national department, as the regulator of the water sector, has been to take action against Tshwane municipality for polluting the environment and polluting the water supply. And in that regard, over a number of years, we've been giving instructions and directives to Tshwane to repair and develop and fix their wastewater treatment works, which they didn't do. And eventually we took them to court to try and get a court order to force them to fix the wastewater treatment works. And that court process has been quite lengthy and is still underway. But yesterday in the meeting, we agreed that we're going to form a partnership with Tshwane, that we're both going to talk to National Treasury and to the Development Bank of Southern Africa to raise funds, and that we're going to jointly manage the project to fix the wastewater treatment works. It's quite unusual for us as the national department to get in to do that, because it's a municipal function to manage and operate the wastewater treatment works. But given this urgent situation, we've agreed that we're going to do it in partnership, and we're going to also work with the Development Bank of Southern Africa to help the city to implement the project expeditiously.
Okay. The city has already indicated that from the preliminary tests that they have done, there is no link between the water and the cholera outbreak. When can we have conclusive results?
I think that's a little bit of a misinterpretation of what the city's been saying. They've been saying that through the tests that they have done, they haven't yet found cholera in the tests that they've done. That's not necessarily the same thing as saying that the original infections weren't related to the sewage pollution in the area. All they're saying is that their tests haven't yet identified the exact location. But because we know that there's been bad sewage pollution of the water supply in that area in Hammanskraal for a long time, it is highly likely that the cholera outbreak in that area is related to that. But we just don't know the exact location where people took water, and hopefully people weren't taking raw water from the dam. But we don't know where the exact infection could have taken place. It could have taken place in a number of places. Someone might have taken raw water from the dam, or someone might have drunk water from the water treatment works. But the test that we as foreigners recently showed that while the water from the water treatment works doesn't meet the standards, while it's got too high a level of E. coli in it, we haven't detected any cholera in it.
Okay.
But it doesn't mean that the cholera outbreak was not somehow related to the sewage pollution problems in that area.
Yeah. So the 2022 Blue Drop Progress Report found that 34% of water treatment systems in the country are in the high or critical risk categories for delivering unsafe water. So this issue of poor water and sewage treatment and poor solid waste removal is still plaguing some parts of the country. So are there other parts of the country that are potential risk zones?
Clement, just to clarify, it was the Green Drop report that we issued last year, not the Blue Drop report. There's an important difference. There's two parts of the system. There's water treatment and there's wastewater treatment. So when you flush your toilet, if you're using a waterborne sanitation system, the sewage goes into a wastewater treatment works. And the wastewater treatment works is supposed to clean the water to a state, that wastewater to a state that it can then be released into the river, and it flows down the river. Then there's water treatment works. Water treatment works draw water from rivers or dams, and they treat the water. They draw raw, untreated water from the rivers or dams, and they treat it so that it's fit for human consumption. The report that we issued last year showed that many of the wastewater treatment works are in a poorly maintained and operated condition in many of the municipalities, which means that they are putting effluent from their wastewater treatment works into the rivers, which doesn't meet the required standards. We have also been looking at the condition of the water treatment works in municipalities, and we're going to be issuing a report on that later this month. So if a water treatment works is working well, then it can remove any E. coli or other pathogens from the river water, and make it fit for human consumption. Municipalities are required by law to regularly test their water coming from their water treatment works to ensure that it meets the minimum standards, and we also check that they're doing tests. Most municipalities are checking their water regularly, but we picked up in our Blue Drop testing that some are not, and we are taking action against those municipalities which are not testing their treated water as required. So yes, there are risks around the country, but there is testing going on, and as soon as we find in any municipality, through their tests or through our periodic tests, or if we find a municipality is not testing, then we will immediately go in and test and check. But as soon as we find that a municipality's treated water is not meeting standards, then we will immediately issue a warning to residents that they shouldn't use that they shouldn't drink that water until the situation is rectified.
But do you have an idea of which areas are more risk zones, so areas that are really dealing with this water quality challenge, so that people can be extra cautious?
My advice, Clement, is that your water is safe to drink unless your municipality or the department or the water board warns you otherwise. If the municipality or the water board or we issue a notice to say that our testing has indicated that this water is not safe to drink, then people should immediately stop drinking the tap water without boiling it first. Okay.
Let me just get an update on the issue of funding. The Tshwane Metro has indicated it needs, over a billion rand or so to help with upgrading that Rooiwal wastewater treatment plant so that they improve the quality of water. You've mentioned conversations with the Development Bank. The minister yesterday spoke of conversations with National Treasury. How soon do you think Tshwane can have some additional funds so that work really is accelerated in upgrading this infrastructure?
The minister indicated in the media briefing, Clement, that we're hoping to get some clarity on the funding issue during next week. There's an urgent matter with the cholera outbreak. So the whole national government is treating it as an emergency with the due urgency. So we expect that by next week we'll have answers to the funding question for the repair and upgrading of that Rooiwal wastewater treatment works.
All right, Dr. Sean Phillips, who's the Director General at the Department of Water and Sanitation, thanks for making time.